Good evening, Pahrump. I'm Dr. Michael Reiner, your host of the show, Independent Doctors of Pahrump, and we have an abbreviated live segment tonight. It's always unusually difficult sometimes to get out of the office on Mondays. With that being said, the first part of the show was some form of rerun from previous shows, but I don't know exactly what they were talking about. But so this is a live segment, and I think we have Barry on the phone that has a question. Barry? Hello?
Oh, yes. Hi, Dr. Reiner.
Hi there.
I recently moved here from a very small town to where I actually knew most of the doctors all my life.
Mm-hmm.
And I saw your advertisements on TV, so I immediately was drawn to your office and made an appointment. And I couldn't get an appointment with you, unfortunately, but I did get an appointment, and I was referred for a colonoscopy due to family history and other stuff going on.
Mm-hmm.
And the number I was given was an office that was actually in Las Vegas, and I just want to know if there's anyone in the Pahrump area that you can recommend for the colonoscopy.
Well, thank you very much for calling in. And I believe the surgeon at the hospital, Dr. Sorensen, does perform colonoscopies. At least the last time I checked, he was doing those. He is a renal transplant physician a surgeon from up in Utah. But he does do colonoscopies because the need is there. I'm sure he'd rather be doing other things, but that being said, he does do them, and the patients that have gone there have had very good results. So I hope that answers your question.
Yes, it does. Thank you so much.
Yeah.
Like I said, I'm from a very small town where my grandmother worked at the hospital her entire life, and I basically grew up there. And so it's kind of embarrassing to go to a new doctor, and it's hard for people. But I want to make sure I go to, like I said, it was a small town, go to somebody local.
Yeah, oh no, I agree with that, and it's a very good policy to support what you have here in this town if you can. The history I've had with Pahrump in general is that it's a very it's an isolated geographic location, pretty much, but at the same time, people haven't always been supportive of the facilities that they have. They've been somewhat critical of them. That being said, I don't think you can please all the people all the time, and I think the hospital has had its issues, but they have a new administrator, Kelly Adams, who does, I think, a very, very good job. He's brought in more services in this town than his previous predecessors have. And that being said, they keep trying to add different services to service the community. So I give them a gold star for trying to improve those things that we don't have. But Pahrump really will always be the redheaded stepchild of Las Vegas, unfortunately, because we are only 50-something miles away, and most doctors today especially are going to be extremely busy thanks to the influx of the numerous patients into the system because of the Non-Affordable Care Act. I say that jokingly because it really is. It's called the Affordable Care Act, but it's not really going to be affordable. That being said, that has created an overabundance of patients that we weren't already, busting at the seams, but we will be even more so. And I think that's good. I have this discussion all the time. I think it's good for the people that haven't been able to get health insurance because they need it and they need the access to services. But unfortunately, as you put more people into the system that was already strained, it's going to be harder and harder to find those services. So if they're available here in town, I think that's the right thing to do.
Okay, well, thank you so much. Like I said, I'm from a very small town. You could probably fit 20 of them in. And when I went to one other healthcare facility within the town, I felt just like I was a number, which I'm not used to growing up with my grandmother who worked at the hospital for 37 years as an RN and knowing all the doctors personally. And then coming here, I felt like a number at the one place, I won't mention their name, where I went. But when I saw you on TV, I went to your office, and I actually felt like I was actually a person.
Well, and I've worked in corporate medicine in this town, and about 2 years or 3 years ago, there really wasn't much in the way of corporate medicine in this town. But then there became a battle between some of the big insurance companies as they started to, gobble up some of the lives, and now it became kind of a corporate issue. And I did try that stint for 6 months. Fortunately, there was another buyout of the practice I was in, and that allowed me to exit stage left, and I took that opportunity. I couldn't really I can't. It's hard to serve money and medicine at the same time. A lot of people can do it. I've never been able to do it, or serve God and money at the same time. It just doesn't really fix. They don't really mix. So corporate medicine was more about numbers, was more about saving money than saving lives. I didn't really agree with all the philosophy involved. It's just like testing in the high schools and the schools. They're more about the results than what we're doing with the individual. And at the end of the day, I have to feel good about what I do. As difficult as it is being an independent practitioner, I certainly wasn't happy with if an employee didn't do well, or someone was mistreated, or someone wasn't taken care of properly. At least under that respect, I had some power over that. Working under corporate, you're just another employee, and you really have no say-so in how the operation is run, and you have no say-so if an employee mistreats a patient, and to have to listen to that all day long and be powerless to do anything about it it just didn't set well with me.
Well, thank you. I appreciate your advice, and I appreciate you being here in the community. Thank you very much.
No, thank you for calling in. I appreciate that, and you could just spread the word. We're trying to take in all the patients we can and help everybody, but it is indeed a challenge. And but thank you for your kind words. And like I said, the hospital here is had its issues, but they are certainly doing a much better job than they did when they first opened up. So give that a try.
Okay. Well, thank you very much.
You're quite welcome, and thank you for calling. So. And I've noticed that also in the town of Beatty, as I start to not really work out there on a limited basis, but I started to venture into that, and Dr. Jonak works up there more on a permanent basis, that the town, when you only give them one choice, they're going to go elsewhere. We hope to bring a little choice in them seeing nurse practitioners or seeing doctors, but it's like a vacant house. If you have a vacant house and you don't tend to it, if you leave it, it will rot from the inside, and it will be a problem, and it will not function very well. So that being said, it is important to not just keep your medical community as a token, but use it. Just don't use it when you need it. Use it when you don't need it. Use your resources to maintain it, and it will survive. Ray, are you on the line?
Welcome back, Doc.
Oh, yeah, I missed you last week. I did a live show, and you must have figured out that I wasn't there and turned it off. So
I waited the first half hour. Once I heard my question, because I'm always on the repeats, once I heard it, I said, well, he's not going to be here. But anyway, my question this week, I'm gonna make this kind of short, but it's kind of amusing. I have a cat named Itchy Kitty. All my cats are named Itchy. This is Itchy 8. Itchy arrived about a year ago, and I haven't seen a mouse since Itchy Kitty arrived. Today, I found a dead mouse in a mouse trap.
okay.
I figure I'm feeding Itchy Kitty too much salmon pate. Louis DeCanio keeps giving salmon pate. So now I'm concerned because I know about hantavirus, and I'm concerned that maybe mice being around, it's like a serious deal. So could you kind of explain that simply and let me know what's going on as far as hantavirus and how serious it is, and I really have to be in fear of mice?
Yeah.
All right. Thank you. I'll get off the air then. Go ahead. Thank you.
Okay. Well, the hantavirus, it's a very, its name almost fills in with it isn't spelled like it sounds, but it almost sounds like a haunted house. It's a very strange virus that is, and I've only researched it or looked at it superficially, but it comes up very sporadically. It just appears and then it vanishes. It appears and it vanishes. The last case, I believe, was the last outbreak, I think, was in Yosemite, where several people were affected with a severe upper respiratory infection. And it appears that that's the mode of transmission, but it is in mice feces, and that is where it comes from. And it just one of these things that there's no way to predict it. There's no way to you can't not like say it's a chicken virus where all of a sudden chickens start dying. You would never know if the hantavirus was available. So I don't really know how you might prevent it, but if you're trapping mice poop is probably the thing you have to worry about the most. And it seems to be in the northern part, mountainous part, California. It comes up in Utah and things of that nature. Here, I'm not so sure. I don't think there's ever been an outbreak in this particular area. But if you're working with mice or trapping mice, and I don't know this to be sure, but I would not clean up a mouse without some form of maybe respiratory protection if you were worried about the virus. It is I believe, a hemorrhagic virus in the fact that it causes clotting of the blood, and people basically they get an upper respiratory infection, and I think that sets off what they call a DIC, as well as other clotting parameter abnormalities, and they usually suffer, and they die. But since you asked that question, Ray, I mean, I can do a little more research on the actual symptoms and maybe put some slides up next time to expand a little bit more on that particular virus. But it is quite scary. I agree. I have been out in Texas where, they've been in a fifth wheel and there's been a lot of mouse droppings, and I just used a mask, not knowing that it would give me any protection at all, but I just felt a lot better if I could reduce the amount of material that I was inhaling in that particular area. So that's all I can tell you for right now, but interesting question, and we can talk a little bit more about that. Or if you have any other questions, we're going to go to break, and then we'll be right back. And thank you for tuning in for this brief live segment. Thank you. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.